Hello everyone, today I will be doing my individual chapter presentation on Chapter 4, Medicare and Medicaid Major Game Changers. On July 30th, 1965, President Lyndon B. Johnson signed the Medicare and Medicaid Act, also known as the Social Security Amendments of 1965, into law. It established Medicare, a health insurance program for the elderly, and Medicaid, a health insurance program for people with limited income. So let's take a look at Medicare. So Medicare is an entitlement program for the elderly and chronically ill Americans. Medicare is financed and administered by the federal government. The program benefits people over the age of 65, and it has 4 parts, Part A, B, C, and D. It is paid by the trust fund, and it's funded with payroll taxes. The program is the same for nationwide, and as we mentioned, it's for people of age 65 and over. Participants pay deductibles for a part of the coverage. So let's take a look at Medicaid. So Medicaid requires a person to meet a certain income criteria. It is a means tested or need-based program that provides health insurance to low-income adults and children, and the financing and administration of Medicaid is shared between the federal and state government. The program differs state by state. It is paid by federal, state, and local taxes, and participants pay very little or no part of coverage. It also participants receive regular dental and visual exams. The current state of Medicare enrollment. We can see the difference between 1966 and 2015, how enrollment has increased. Same goes for spending. In 2021, Medicare benefit payments total $829 billion, from up $541 billion in 2011. Spending on Part B services, including physician services, outpatient services, and physician-administered drugs, account for the largest share of Medicare benefit spending, that is 48% in 2021. Payments for Medicare Advantage plans for Part A and Part B benefits nearly triple as a share of total Medicare spending between 2011 and 2021, from $124 billion to $361 billion, due to a steady enrollment growth in Medicare Advantage plans and higher per-person spending in Medicare Advantage than in traditional Medicare. As we mentioned before, Medicare has 4 parts. Part A covers inpatient hospital stay, skilled nursing facilities stays, some home health visits, and hospice care. Part A benefits are subject to a deductible that is $1,364 per benefit period, and that was in 2019. Part A also requires coinsurance for extended inpatient, hospital, and nursing facility stays. Part B covers physician visits, outpatient services, preventive services, and some home health visits. Many Part B benefits are subject to a deductible. In 2019, it was $185, and typically coinsurance of 20%. No coinsurance or deductible is charged for an annual wellness visit or for preventive services that are rated A or B by the U.S. Preventive Services Task Force, such as mammography, or prostate cancer screenings. Then Part C, which is known as Advantage Program, Medicare Advantage Program, beneficiaries can enroll in a private health plan, such as a health maintenance organization, an HMO, or a PPO, and receive all Medicare cover Part A and Part B benefits, and typically also Part D benefits. Enrollment in Medicare Advantage plans has grown over time, with more than 20 million beneficiaries enrolled in Medicare Advantage in 2018, or 34% of all Medicare. Last part, Part D, covers outpatient prescription drugs through private plans that contract with Medicare, including standalone prescription drug plans, PDPs, and Medicare Advantage plans with prescription drug coverage. Enrollment in Part D is voluntarily. Here we can take a look at the sources of Medicare revenue in 2017 for Part A, Part B, and Part D. Now we'll take a look at the current state of Medicaid and how Medicaid enrollment and spending has changed since 1960 all the way to 2016 and beyond. Medicaid is a particularly important source of coverage for certain populations. In 2021, Medicaid covered 4 in 10 children, 8 in 10 children in poverty, 1 in 6 adults, and almost half of adults in poverty. Relative to white children and adults, Medicaid covers a higher share of Black, Hispanic, and American Indian American Native children and adults. Medicaid covers 43% of non-elderly, non-institutionalized adults with disabilities who are defined as having one or more difficulty related to hearing, vision, cognition, ambulation, self-care, or independent living. The Patient Protection and Affordable Care Act, also referred to as the Affordable Care Act or ACA, was enacted in March 2010. The role of the Affordable Care Act is to make health insurance available to more people, expand the Medicaid program to cover all adults with income below 138% of the FPL, support innovative medical care delivery methods designed to lower the cost of health insurance. Here's 5 things to know about the Affordable Care Act. As of 2024, Florida is one of the 10 states where the ACA's expansion of Medicaid for low-income adults has not been implemented. Thousands of Florida kids are losing Medicaid coverage on this Easter Sunday. Please take a look.